Let's go ahead and bring our jury in. Please be seated. Folks, I apologize. Our 10, 15-minute break stretched into a 40-minute break, and that happens, unfortunately. We're going to go ahead and continue on at this point. Mr. Knock, call your next witness, sir.
Your Honor, I'm going to call Dr. Taylor.
Edward Taylor?
Yes, sir.
Okay. Mr. Edward Taylor. Sir, thank you for joining us this afternoon. That chair is bolted to the ground. Everybody tries to pull it forward closer to the microphone, but you can't. You need to lean into that microphone a little bit. If you'd introduce yourself to the jury and spell your first name and your last name for the court reporter, please.
I'm Dr. Edward Taylor, E-D-W-A-R-D-T-A-Y-L-O-R.
Thank you. Please proceed.
Dr. Taylor.
I'm sorry. We have a witness that's still in the court. Okay. Thank you. Please proceed.
What do you do for a living, sir?
I'm a child and adolescent psychologist.
Do you have a clinical practice?
Yes.
And what does that mean to have a clinical practice?
That means I see children and their families and provide diagnostic and therapeutic services for them.
So you basically you treat people as opposed to being a researcher or an educator or something like that.
Correct. I treat people.
And so is your clinical practice your full-time occupation?
Yes.
How long have you been a child and adolescent psychologist?
35 years.
And have you been in clinical practice for that whole 35 years?
I have had 2 stints on the faculties of 2 different medical schools. The University of Kansas School of Medicine at the Wichita branch and the University of Florida School of Medicine at the Jacksonville branch.
And is your practice currently located in Jacksonville?
Yes.
Can you describe your educational background?
I received my PhD from the University of Florida. I completed an internship in clinical psychology at the University of Kansas School of Medicine, and then completed a postdoctoral fellowship in clinical and health psychology at the same location.
And so what was the second university?
Clinical and health psychology, a fellowship.
At what university?
University of Kansas School of Medicine.
Is your the education you've described the education required of a child and adolescent psychologist?
Yes.
And have you had any continuing education in that field?
I have the 40 or more hours of continuing education every biennium that's required by law.
As a part of your clinical practice, do you examine children and diagnose difficulties in learning?
That is the major part of my practice, yes.
And then, of course, then you treat your patients based upon your diagnosis. And
I offer treatment through my practice. I also coordinate and collaborate with the schools that they attend. And I have a group of educators in my practice who provide educational services as well.
have you ever testified as an expert witness in a court of law?
Yes.
On how many occasions have you done that?
It's hard to say. I don't do it a lot. It's maybe 15, 20.
15 or 20 in your entire career?
Yes.
It's a paid expert is not a regular part of your occupation?
No.
On the occasions when you have testified as an expert, in what field did you testify?
It has been exclusively child adolescent psychology for the past 10, 15 years. I did do some adult testimony way back when, but
Have you ever been offered as an expert in child and adolescent psychology and been refused to testify as an expert?
and I refuse to
And
testify?
have been refused, have not
No.
been considered?
No.
Your Honor, this time I would tender the doctor as an expert in child and adolescent psychology.
Do you wish, why do you here?
I do not.
The jury can make their own determination regarding the expertise.
Were you retained by me to conduct an examination of Bessman Okafor,
Not of him per se.
of his educational background?
Yes.
What specifically were you asked to investigate?
I was asked to form an opinion as to whether the records reveal the presence of a learning disability of any type, to examine the interventions that have been offered to him and the outcome of those interventions, and then to offer, based upon my experience and knowledge of the research, what is known about the effect of learning disabilities on the development of an individual's coping skills, life adaptation skills, emotionality, and personality.
Is the diagnosis of a learning disability similar, that you conducted in this case, similar to what you do in your clinical practice when you're actually treating a patient?
In the clinical practice, I review any prior testing or records that are available, but I will do my own assessment of the individual with a fairly extensive battery of psychological and psychoeducational tests.
Normally in your clinical practice, your patients are children and adolescents?
And young adults who are in college.
Okay. Do you often or treat patients who are grown adults who are in their 30s?
I have on occasion seen adults who have raised the question of whether they might have a learning disability or an attention disorder that would be limiting them in the workplace.
What records did you receive in this case?
I received academic records, which included transcripts, 2 psychoeducational evaluations performed by the Orange County Schools, IEPs, and various other documents that are part of the IEP development and monitoring process.
Were they of the type that you normally receive when evaluating a patient?
When I request records from the school system, these are very typical of what I receive, yes.
Was it your understanding that you received all the records available?
Yes.
Were there a couple of gaps?
I don't have academic records from his 4th grade year. There was a psychoeducational evaluation performed in the spring of his 5th grade year, and the first page is missing.
And other than that, does it appear to be a complete set of his educational records?
Yes.
Were the records sufficient for you to form an opinion of whether Bessman Okafor has a learning disability or had a learning disability?
Yes.
And what is your opinion?
There was clear evidence of a language-based learning disability that affected the development of reading, writing, and math.
Clear evidence of a language-based learning disability?
Yes.
And can you explain what a language-based learning disability is?
The brain has a number of information processing systems. The left hemisphere for most of us are the systems that process sounds, that process words, that allow us to make sense of what is being said to us and to use language to communicate and to solve problems. If those systems are not working well, then a number of academic skills, especially in young children, tend to be delayed, specifically learning to read and write, and acquiring automaticity with your math facts. And a number of adaptational skills can be limited, the ability to use words to tell people what you think and feel, and to negotiate conflicts with other people, and to represent internally solution processes for problems that you're facing.
So in Bessman Okafor's case, you found clear evidence of a language-based learning disability?
Yes.
Is that a disability that is present from birth or something that's acquired later on?
If it is acquired, then it's not considered a developmental learning disability. If he had an insult to the brain through a blow to the head or something, that's a different notion. His type of learning disability would have been developmental, meaning that it should have been seen in some form as early as his infancy or his early toddler years.
Are his school records, do they consistently show evidence of this learning disability?
Yes.
And you indicated that one of the effects is that it makes it difficult to process sounds and words?
Yes.
And by that you mean difficult to understand spoken speech or written speech, I suppose, for that matter?
Well, we're talking about two different levels of processing. Reading is an invented skill. It was invented about 5,000 years ago as a way of communicating with people who are outside of earshot. And we do that by using this code we call the alphabet to graphically represent what we want to say. We send that code to the recipient, and they look at the symbols, and they convert them back into the sounds that each of those letters or letter combinations represent. So if I wrote C-A-T, the listener would look at that and say, oh, he said k-a-t. Now that's processing sounds in a way that lets us learn to read. Now you may or may not also have difficulty remembering language, taking language in and making sense of it or converting it into an action plan. Then you're starting to get into the interface between the sound system and language, which is a higher order skill.
And in Mr. Okafor's case, could you tell from the records whether his difficulties were in processing both written and verbal language?
There is a reference in the documents surrounding his 5th grade assessment that suggested that he had difficulty making sense of what was said to him. There was an formal assessment of his language done early that year, which found difficulties with expressive language, meaning finding words to speak, as I'm doing now, receptive language, as you're doing now, to take in what I'm saying and make sense of it, but also what is called syntax, the structure of language, getting things in the right order and usage. So there was evidence from that testing of a language processing issue, but because his reading and spelling were exceptionally weak, you would have to assume that he was having issues with sound processing as well, although those skills were not formally assessed by any of the examiners who saw him.
Would your findings based upon reviewing Mr. Okafor's records be consistent with a history of him being delayed in learning his ABCs in spelling and in speech?
Right. You can see the early manifestations of these sorts of information processing issues in toddlers who may have delayed presentation of speech. They have trouble learning the names of colors and shapes and letters and numbers. Now you can see it, those precursors, as early as age 3.
Is the problem, the particular problem that you diagnosed in Mr. Okafor, common?
Reading difficulties that are caused by these neurologically based information processing issues occur somewhere around 10% in the population. Language disorders, maybe a bit less, maybe around 7%.
And is there varying degrees of this problem?
Yes.
So there can be people with a severe language-based learning disability and others with a more minor learning-based disability?
Yeah, not only in terms of how their sound processing and language processing is involved, but also in terms of what other assets do they have that you can tap into to help them learn to work around or compensate for the information processing issues.
Okay, so there are different levels of disability and also different coping skills
Yes.
that are available to different
Yes.
kids. Okay. And so I assume additional coping skills will assist one person's performance compared to somebody with a similar disability but not the same coping skills. Does that make sense?
Yeah, I mean, we all differ in the skill sets we have for getting things done, and the research is pretty clear in the long-term outcome studies of learning to be successful despite a learning disability. If the student has the opportunity to develop their strengths while they're receiving intervention for the challenges, they tend to have a better outcome than if those strengths are not integrated into the learning process.
Did you have sufficient data to form an opinion as to the severity of Mr. Okafor's learning disability, his language-based learning disability, compared to others with the same type of disability? In other words, was he on the severe end of the scale, mild, somewhere in between?
Your Honor, I'd like to object and voir dire on the basis of information he has.
I'm having trouble hearing
sorry,
you.
I should put this on. Your Honor, I would like to voir dire on the sufficiency of the basis of his information to render this opinion,
On this most recent opinion.
the ones he's about to give.
No, that was my question, was whether he has sufficient information.
Oh,
Well,
I'm
he-
sorry. I'll wait for the answer.
He
then.
can answer that, yeah. You're a bit premature.
No.
Sir, you may answer.
Thank you. I can form an opinion about the academic effects of his learning disability in 5th grade, and then again in, I think it was 7th grade. His, in 5th grade, his reading...
Objection. He's about to give the opinion, so. To voir
He's
dire.
indicated he can form an opinion based upon his,
He indicated he can form an opinion about 5th and 7th grade.
yes, or
And-
based upon the 5th and 7th grade records.
And I would
And
like
that's
to
what he
voir-
wants to do at voir dire on.
Well, I would suggest that's more appropriate for cross-examination.
Not, depends on whether he's going to express the opinion, and that's one of the things the court has to decide. You have a chance to voir dire on that issue.
Thank you. Doctor, you indicated in your normal practice when evaluating an individual, you interview that individual. Is that correct?
I'm sorry, I
In
do...
your clinical practice,
I
when
do interview the individual?
you would interview the individual.
Yes,
And that is a standard practice.
absolutely.
You also indicated that you would give an extensive battery of tests in order to evaluate their learning disabilities, correct?
Correct.
And in this case, you did neither of those.
Correct.
In your private practice, would it ever be acceptable practice to render an opinion on learning disabilities based solely on a record review?
It would be inappropriate to offer an opinion based of the person's current status of their learning disability, but not the status of the learning disability at the point of time that the records documented the disability.
And do learning disabilities change over time?
They can.
Okay. If the question is limited to that period, I believe he has
I
sufficient.
believe that was the question that was asked.
Yes, and maybe I can help. Is it your understanding that the opinions we are requesting are for the time periods for which you have records?
Yes.
In other words, is it your understanding that I'm even asking you about current disabilities Mr. Okafor may or may not have?
Correct.
So based for the time period for which you have records, do you have an opinion of the severity of his language-based learning disability?
I do.
And what is that opinion?
Based upon the scores obtained on achievement testing of his reading, writing, and math skills, it was quite severe. His reading in 5th grade was at the 2nd percentile, meaning 98 students out of every 100 his age read more effectively than he. Math was at the 5th, and his written language skills were at the 1st, bottom 1 out of 100. And the measure of his intellect, given at that time, found him to have average nonverbal skills. He could work well with nonverbal patterns and visual spatial information and complex problem solving, but his language-based intellect was at the 4th percentile. There was a 28 IQ point discrepancy between his verbal intellect and his nonverbal intellect in favor of the nonverbal. And a discrepancy of that magnitude occurs in less than about 2% of the population. That's a huge difference.
So, if I understand you correctly, in measuring his intellect using nonverbal measurement techniques, things that don't require spoken language, he measured in the average range.
Yes.
So around 50%?
Right. It was probably 53 percentile.
Okay. But if he was being measured for intellect using verbal techniques, then he was down in the bottom 1 or 2%.
Bottom 4th percentile.
4%?
4th.
overall. Okay, so 96 out of 100 students would measure higher than he
In language, yes.
in language. So, and is that what suggests to you that his problem is a language-based problem and not simply a low intellect?
Objection. He said problem is, not was. I understood the opinion was in the past, not in the present.
Sustained.
Was.
Right. Yes, it's clear that his learning disability that time involved language-based information processing.
If you had been treating him when he was school age, the time period you had those records, were there treatments that would have been available?
Yes.
And were those treatments that were known at that time or just known now?
The intervention for language disabilities is much better now than it was then, but there were interventions for, language delay, then.
And what would the interventions have been that would have been appropriate at the time?
Well, he would have been involved in language therapy with a speech pathologist who would have worked with him on acquiring working vocabulary, making sense of what was said to him, using language in what's called a pragmatic way to communicate with others, to voice his needs, to resolve conflicts. But there would have also been intervention for the academic deficits, specifically the reading and spelling and the acquisition of the math facts. There were, at that time, interventions based upon the Orton-Gillingham methodology for addressing, developmental reading disorders that should have been utilized, or could have been utilized, if you would, to address those academic deficits.
Did the records indicate whether he had had any of those interventions?
The IEP that was developed to his 5th grade year showed that for the reading, one of the interventions that was suggested was the Reading Mastery Program, which is published by SRA. It's been around for a long time, and it's a direct instruction program. There's nothing to suggest in the records that he was ever given language therapy.
Is there any improvement in his performance that would suggest that he'd been given any intervention?
The academic tests that were administered in the second evaluation showed that his reading and math had come up maybe 4 or 5 points, which would place him then at the 6th percentile in reading and 7th percentile in math. His writing continued to be at the 1st percentile. So by 7th grade, 2 years later, there was negligible benefit. There was no, beyond that 5th grade assessment of his intellect, there was no further assessment of his language skills or higher level intellectual skills. So I don't have any idea what had become of that.
What are the effects, if any, on a child's behavior based upon an untreated language-based learning disability?
Objection to a generalized question, not applicable to this defendant. It's not relevant.
I can rephrase, might help.
You'll need to rephrase and focus it.
Are there typical effects that are seen with children with untreated language-based learning disabilities?
Same objection. It's general and not specific to this defendant.
Sustained.
Did the records reflect any behavioral issues that were caused or potentially caused by language-based learning disabilities?
Objection. I don't believe the witness is qualified to determine the cause of a behavioral problem. in this, on the limited basis what he has.
Your Honor, I tried to ask him about that and he was objected to. I think he is-
There's not a basis for that right now. Objection sustained.
Are you familiar with what, if any, behavioral problems result from learning-based language disabilities?
Objection, same question as previously offered.
Approach, folks.